Good evening, everybody. A very warm welcome to this interesting webinar. It is my privilege to please introduce our Honorable Pro Vice Chancellor, Dr. Professor Farzana Mahdi, ma'am. Madam is a PhD, former GSMC Fellow, as well as a Fellow of the National Academy of Medical Sciences. Besides being our Pro Vice Chancellor, Madam is the Director Academics for ERA's Lucknow Medical College and Hospital, the Director of the Department of Personalized and Molecular Medicine, ERA University. Amongst the many achievements that Madam has established the ERA's Lucknow Medical College and Hospital. In 2001, the ERA University in 2016. Madam has pioneered the certificate and postgraduate diploma course in health professions education with collaboration of the Sadiq International Virtual University. Madam is the General Secretary of the Indian Society of Personalized Medicine, as well as the General Secretary of the Allied Health and Healthcare Professions Education and Research. For the honors, Madam has been the Fellow of National Academy of Medical Sciences, Fellow of Indian Academy of Biomedical Sciences, and the FAMR Fellow from GSMC Mumbai. Amongst the many publications that Madam has, the books to her credit are The Precision Medicine on Human Health, Clinical and Procedural Skills, a Step-by-Step Approach, and more than 150 publications in journals of national and international repute. It is an absolute honor to host Madam for the prestigious oration. We will be handing over the session to Madam.
Good evening, everyone. At the very beginning, I would like to express my gratitude to Professor Tejinder Singh and Professor Sanjay Bedi for giving me this opportunity to deliver this very prestigious oration. Thank you, MEU India. I never met Dr. Sood, but from what I heard, she was a compassionate, caring, soft-spoken physician and an astute clinician. A role model for everyone, she actively contributed to the activities of the Center for Medical Education at AIIMS and globally in various capacities. It is with utmost humility that I accept this oration. So the topic for today's oration is the integration of social determinants of health in health professions education. Are we doing enough? Just give it a thought as I begin my presentation. So at the end of this session, we will be able to know better about social determinants of health. We'll be describing the role of social determinants of health, how to apply knowledge to practice, and equip stakeholders to address social determinants of health and promote to health equity. So what are social determinants of health? As given by WHO, the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. So, in a way, they are non medical factors that influence health outcomes. They are the conditions in the environment where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. So, now having known what are social determinants, why do you think that they matter? And why should we be talking about it today? So, according to key statistics, about 80 to 90% of the health outcomes are determined by factors outside the healthcare system. Only 10 to 20% of health outcomes are attributable to clinical care. Social factors account for more premature deaths than genetic predisposition, behavioral patterns, or environmental exposures. So, taking it further, we would now like to tell you about the 5 key domains of social determinants. They being economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, social and community context. So, in this slide, before moving to the any further, I would just like to draw your attention to this slide where we are talking about creating change agents. And the change agents can be created by shifting the spotlight from disease treatment to health prevention and creation, by addressing the social determinants of health, which will ultimately transform healthcare professionals into agents of the transformative change. And these 5 domains, key domains, they interplay and with one another and try to create the change agents. So this is important for us to understand that all the time when we are just thinking about the disease, let us try to, work on the preventive aspects of any disease. So the first domain is economic stability. And here, as you see that how the economic factors influence health in terms of employment status, whether you are employed and how much income you draw. Because the more income you will have better housing, better nutrition, and access to healthcare. And at the same time, you will be able to, fend for your bills related to any kind of emergency situations. But those who are not having enough money, they cannot pay for the bills, and it comes as it creates a kind of a financial strain for this kind of population. And housing facility security, it does affect a person because it gives you safety, security, and otherwise, if you don't have, it is going to give you some stress levels. So, what is the relevance of economic stability? If you are not, financially well off, the patients at that time, they may start skipping medications. the delay care is going to come in to play, and they can experience stress related conditions due to financial constraints. Education access and quality. As you all know that education improves ability to understand health information and navigate healthcare systems. The employment opportunities are better if you are well educated. You tend to show healthy behaviors as education promotes knowledge about disease prevention and health promotion. Social networks, educational settings provide social connections and support system, which helps you navigate through thick and thins of life. So when you are dealing with the patients, you need to know the background of the patient, and according to the education level, you need to tailor the communication so that the patient is able to, build a trust and can have faith in you. And so the healthcare delivery is going to be easy for them. Third being healthcare access and quality. As you all know that, there are a few barriers to healthcare access. Insurance coverage being one. Insurance coverage, they say that it is health insurance, but most of the time it is the company takes care of the person when a person falls sick, or they have already are having a disease and they are calling this health insurance. So it's kind of like when it is already set in. So if you have to ensure health, you need to do work on the preventive aspects as well, instead of just looking and providing the providing the help when disease. Rural areas, because of the geographical access, they may lack healthcare providers and facilities. There might be cultural barriers, language and cultural differences can provide bias, affect care quality, provider availability, shortage of specialists and primary care providers in underdeveloped areas. So, how can we help those patients who are having these kind of difficulties? You can consider their transportation and their work schedules before planning for their treatment, and child care when scheduling appointments and treatment, so that they are more at ease when they come for the medical facility. Neighborhood and environment factors also affect health, like housing quality, transportation, environmental safety, food access, because nutrition is being the key element for delivery of health. So when you are considering the patients, you should consider these environmental factors when you're trying to discuss recommendations, because as in form of medical storage and follow-up, because some of them might not be having those facilities existing in their rural areas, not having a fridge to maintain a cold chain and things like that. So you have to keep into mind when you are advising the patients. Social and community context. Social factors which influence health may be social support, because it builds networks to improve mental health and provide practical assistance. Community engagement, civic participation provides social cohesion and collective efficacy. Discrimination at times leads to certain kind of problems where the patient cannot build trust with the doctor or any other uh, person in the hospital, be it in form of racism, sexism, or any other kind of discrimination. Cultural norms sometimes, community attitudes towards health behaviors can influence individual choices. So, what can we do to avoid these problems? We should try to assess social support systems and be aware of how discrimination may affect patient trust and health outcomes. So, having discussed the five key domains, now coming to social determinants of health, the Indian perspective, because India, as you all know, there is a population diversity with 1.4 billion people across 28 states, 8 union territories, 22 official languages. There are economic disparities. As you all know, that 65% of the rural population has difficulty in getting these health benefits. Cultural, again, you know that we have so many castes, religion, gender norms, which can significantly impact health access. So, understanding social determinants of health in India requires considering the complex interplay of socio-economic, cultural, and geographic factors that shape health outcomes across diverse populations. So, when we have already discussed this economic stability, about the impact of economics on the health. What we see that of late, our Honorable Prime Minister has launched this Ayushman Bharat scheme, which provides health coverage to 40% of the population. But a lot of implementation challenges still remain because it's difficult for the people, some of the people, to have access to Ayushman Bharat. Government is trying its best, so are all the hospitals, and at the same time, there are a lot of state level also funding is being provided, so that people who are not so well off, they can also come and avail the facilities when they are sick. So as far as the education access and health literacy is concerned, we all know where we stand, but we know that ASHA workers, they have been appointed. There are almost 1 million community health workers, which try bridging literacy gaps. And these ASHA workers are the link between the rural population and the healthcare providers. But most of the time, what happens is that the healthcare workforce, they do not work hand in hand with ASHA workers, and somewhere they are doing their own duty. Of delivering the health at the community level, and doctors are doing their own work at the tertiary level, and the link is missed. So if that link is built, and we all come together and start working together, a lot of health related issues can be dealt there and then, and hence healthcare access can be given to people who are not able to come to tertiary care hospitals. We have recently seen that Jan Aushadhi Kendras have been established in all the medical colleges and in the cities, where you get generic medicines which are very affordable, and the patients can get these medicines at subsidized rates, which comes as a great help, because as you all know, the pharma industry, the the price of the medicine is just going up every year. Social and cultural context in India, we've already talked about it, that there are so many aspects. So the healthcare providers must understand the local beliefs, their practices, social hierarchies, uh, and then only they will be able to build the trust and provide effective healthcare to the patients. Environmental challenges, you know that air pollution is on the rise, and there is a lot of difficulty still for water and sanitation, and climate change, heat waves, floods, drought affecting health. There is also too much of indoor air pollution, which is causing so many diseases which never used to exist around 50 years back. So government has again come into the play, and we have seen that Swachh Bharat Abhiyan was launched, and which is taking sanitation mission by improving hygiene and reducing disease burden. At the same time, Jal Jeevan Mission is there, which for providing tap water connections to rural households. And there are so many NGOs and other facilities which have come up, and they are trying to talk about the environmental challenges, and and helping the communities by reaching out to them and providing them with the solutions. So now, having known about what are social determinants of health and how they can interplay to create that, build a change agent, uh, so that the focus can be shifted from the disease to prevention of the disease, and in depth knowing about the 5 domains. Now, we at this juncture we need to ask ourselves that we as a community of medical educationists, are we doing enough? Ask yourself, and I would like some of you to, put your thoughts in the chat box, uh, so that we can come to know what are you thinking. So, as you all very well know, that are we doing enough? No, we are not doing enough. The more I read about this topic, the more I started thinking in those terms, because social determinants being everywhere in the curriculum of the medical students, nursing, and health professionals, it is there, it is everywhere. But nobody thinks about it the way it should be treated. The importance of these social determinants, how they shape the health scenario of any country. Because all the time talking about the disease and the hospital setting, the clinical care, which is not enough. So currently, as you all see, that the medical education is predominantly, it is disease focused, and SDH coverage is theoretical and limited. Students lack practical skills in addressing social determinants. Faculty need significant development in this area. Assessment methods do not adequately evaluate the social determinants of health competencies. With all these things in our mind, now let us go further and see what can we do and how can we bring about the change. So, in order to move ahead, as you all know, that knowledge, skills, and attitude, the change can be brought about by focusing on these three aspects. So, knowledge, as you see here, that we need to focus on the income and wealth, employment status, social support networks, physical environment, neighborhood and community, having knowledge about race, ethnicity, culture, gender, sexuality, also political, economic, and social systems. It's going to help us. Now, in order to get down to the skills, you have to take the social history from the patient in a complete and organized manner and collaborate with team including different health professionals to address social cultural issues at patient and individual level, and develop leadership skills so that the health problems at societal levels can contribute to its resolution. Attitude, of course, being most important, because if you don't have the right kind of attitude, you cannot deliver. How much knowledge you have, how much you know about the skills, the attitude, if not there, the positive kind of an attitude, where culturally and socially sensitive you have to be, and you have to respect beliefs, values, religion, and you have to demonstrate interest, commitment, and helping attitude to try their best to find solutions for this kind of community. So having the knowledge, skills, the attitude, now you have to have uh, appropriate teaching learning approaches in integrating social determinants of health into the curriculum of health professions education. So the entire exercise is to understand it, to so that the importance of it, and then having worked upon all these aspects, and now having this teaching learning approaches, you can go ahead and try to implement it into the curriculum of health professions education. So this can be done by having service learning, community-based education. You can have interprofessional education, case-based learning, simulation-based learning, and self-directed learning. Here we'll be sharing some structured examples to incorporate social determinants of health in HPE curriculum. So this is just, we are trying to give an overview where needs assessment has to be done. We have to identify the stakeholders. Needs assessment according to your curriculum mandates has to be worked upon. Stakeholders, heads of the teams could be either medical, nursing, allied, community-led leaders, patients, families. And then very important, you'll have to identify the learning objectives for that profession, for which you are trying to work for the curriculum. And with the learning objectives, now you need to work on the teaching learning methods, and these can also be in form of awareness camp, nukkad nataks, and various kind of activities which you can go and do at community level. So this again, you can see, again, this is, you have to just identify, you do your need assessment, identify the learning outcomes, and forming a leading group who can work together and implement it. So again, you can see here, this is mode of integration in identifying the factors for integrating SDOH into the curriculum, identify the contents, create working groups, establish committees with the representatives, and so on and so forth. And the next step is important, that faculty development program has to be there in place so that you can train the teachers to align with social determinants of health and its main objectives in the curriculum delivery and the implementation. So once everything is in place and it has been incorporated, now we need to see the assessment part and the program evaluation. So student assessment can be done. You can develop reliable methods to evaluate student understanding of the SDOH. Curriculum mapping has to be done by aligning curriculum phases to ensure balanced coverage of SDOH objectives. Program evaluation by conducting surveys to identify program strengths and weaknesses. And last but not the least, research and advocacy by promoting further research and public policy advocacy for social determinants of health. So this is another example where in our curriculum, where we can see how we can integrate social determinants of health, a comprehensive framework. This is year-wise, year one in the foundation. You can see year two application in the second year in terms of community projects and interdisciplinary learning. Year 3 and 4, clinical integration, where social determinants of health in patient care, community rotations, and population health can be taken into consideration. And once the students come to the internship level, he can go and practice in terms of community programs and policy advocacy and social screening. This is just one of the looks. Yeah, sorry. So this is after the phase-wise. Now you see subject-wise integration. This is horizontal integration across discipline, anatomy, physiology. Every subject has given its own elements. So we just need to take them out and start focusing and trying to implement it into the curriculum in a holistic way so that the student understands it's important, tries to internalize it, and then once going out and practicing, he will keep those, all these determinants in his mind when he is trying to treat the patient, or for that matter, any other healthcare worker. So these are the different subjects and how you can integrate. This is again one of the examples. We have prepared module for dengue, hemorrhagic fever. It is alignment and integration, which we have seen by taking up this disease. And here you can see subject-wise, the subject is there, the competency is there, and all the departments, how they are coming together in order to see the different elements, how a patient can be treated. So subject-wise integration, it's integrated session with all stakeholders, facilitators, and students. Case presentation, incorporative learning, objectives of all the relevant subjects are given here. Here you can see example of vertical and spiral integration of social determinants of health in a medical curriculum. You see at the top that the basic science, clinical science, social and behavioral science, community health, leadership, personal and professional development, they all come together and interplay. And other elements, as you go up the spiral, you see income and wealth, education, employment, and all the other factors which help to create this. And here I would like to share with you this paper from which we have taken a lot of reading by Muhammad Al-Hassan Abdullah. So coming to kind of sum it up, we would say that in our curriculum, we have all these things. At this ADCOM is there, self-directed learning, small group learning, early clinical exposure, skill labs, reflection, integration, assessment tools, electives, family adoption program, pandemic module, foundation module. All these are there embedded in the curriculum. Only now what we need to look, that we have to apply, SDOH, the knowledge, skills, and once it is applied, we have to develop the professional attitude by we have to cultivate SDOH mindset and also work on their professional attitude, so that once they come out, they finish their, they become an IMG, and they are out in the community to go and practice, they can be part of this transformative learning by service learning and critical reflection, and creating this health for all. So after this discussion, I'm sure a lot of you would also start thinking about the importance of social determinants of health as being an integral part of health advocacy. Because we all know, we all somewhere know the importance, but we just cannot do enough justice of giving them a proper place in the curriculum and highlighting it to our students, the role of social determinants of health, because somewhere it is said कि जो जाग रहा है, जो जाग रहा है, सोते हुए आदमी को जगाना आसान है, मगर मान लीजिए कोई जाग रहा है तो उस जागे हुए आदमी को जगाना बहुत मुश्किल हो जाता है. So this came into my mind because I myself was one of them before I moved and tried to cover this topic. So a lot of thinking is going on even in my head as in terms of implementation, and I hope that this conversation today must have awakened a new kind of thoughts and ideas, and we need to question ourselves as to that, are we doing enough or not? So what is, ladies and gentlemen, what is the path forward? Significant work remains to ensure that health professionals are adequately prepared to address the complex influence of social determinants of health on patient and population health. A concerted and coordinated effort is needed to integrate SDOH into health professions education comprehensively and effectively to achieve true health equity. And I would like to thank Professor Sucheta Dandekar Madam, Professor Neema Ma'am. They are my teachers, Dr. Anuja Bhargav, and the entire team who's been with me to prepare this presentation. And once again, I would like to thank MEU India for giving me this opportunity. Thank you. Thank you very much.
Thank you, ma'am. It was a very lecture with a very deep thought, and I also thank Dr. Anuja for the session, for holding forth while I was in flight. So,
thank you, sir. Thank you so much, sir, for this honor. Thank you, sir, once again. To Tejinder Singh and Dr. Sanjay Bedi. Sir, thank you so much for recognizing and giving me this platform. Thank you. Once again. I'd like to take leave of all of you. Thank you once again. And